wrist. Extensor carpi, radialis longus, brevis, ulnaris. So again, most of these will start. That's good. Most of these are going to start lateral epicondyle, right? Yeah, okay. All right. Okay, now look at the radialis longus. It goes and it goes, it says, to the second metacarpal. So it's going to go here, right? And what's it do? It does extension, of course, and it does radial deviation. That makes sense. See where the line of pull comes? So again, resist it, push it in my hand, resist radial deviation, push it in my hand. The next one is Radialis Brevis. It goes to the third. Same line of pull to the second, same line of pull goes to the third. It goes right down the middle. So what's it do? Wrist extension. Push into my hand. So you see we're going, everything's the same, but we're going to second, we're going to third. Extensor carpi ulnaris goes to the fifth. I mean, if you want to learn kind of and save yourself some headaches, I think, just look at those three muscles. They're very identical. Origin comes to the same place, one goes to the second, one goes to the third, one goes to the fifth. And with these, you can actually tell what's going to happen. I mean, the first one's going to do wrist extension, and it's going to do radial deviation. When it goes to the middle, the third, it's just extension. It doesn't do any deviation. You just push into it. The ulnaris comes down, of course, comes down the ulnar side. That's another key to it. It's going to come down the ulnar side to the fifth. And what's it do? It does extension, right? Anything else?
Ulnar deviation.
Yeah. So you got radial, you got ulnar, you got one that comes right straight down the middle, and it just goes straight up. I mean, it starts making sense on these three muscles. So I kind of group those together. You know, oh yeah, here, here, and here. I mean, you can start putting stuff like that together, I think it's going to help. Extensor digitorum, lateral epicondyle again, comes down to the extensor expansion of the four fingers, and it extends at the MP joints, right? Extend, so we just push into my hand. And you always want to try to stabilize the proximal muscle, bones or whatever, proximal joint. Even if you're doing exercises, it's the same theory. So when she does extension, push into my hand. If I don't, she starts getting wrist extension. If I say push into my hand for that one, she's throwing her wrist extensors in it. Don't do that. Stop here, hold it there, push into my hand. And it does extension of the wrist. So this one you would come back on it, push into my hand, okay? But to show me the MP joint extension, stabilize it here, okay? And then come back here and stabilize it, because it does two things. The expansion, and the book's got a really nice picture of that expansion. So it just comes down, and it's just that connective sheath. That's all you got to tell me. You don't have to be very picky. Just it comes down, extends for expansion of the four fingers, and it extends at the MP joint, extends at the wrist. Resist. That's good enough. These hand muscles get very intricate. We don't worry about that. I just want the basic bare bones of this stuff, okay? Extensor Pollicis Brevis and extensor Pollicis Longus. What's Pollicis? The thumb. It's telling you. Okay. Extensor Pollicis Brevis, which means the thumb. This is the different. You can't come off the lateral epicondyle. This is where you got to make a little asterisk in your head. These are the two that do not use that lateral epicondyle as for the extensors. But these are extensors. Extensor Pollicis Brevis comes off the posterior radius. So again, you get kind of messed up with the hand being this way. You got to go back to anatomical position, okay? So, but it's posterior radius right here. And where does it run? Base the proximal flanks of the thumb. So it goes right up to here. The base of the proximal flanks of the thumb goes right up to here. So it comes up to here, and it's going to extend at the MP joint. So extension at the MP joint. I'm going to, again, push it in my hand. I'm going to kind of stabilize that right there because it's the MP joint that I want to get the extension out of. And It does wrist what? Radial deviation. I don't like to say abduction because I'm not, this is me, abduction or radial deviation is fine. But when I'm doing this, I get screwed up if she's sitting here and I'm thinking that's adduction. No, it's not abduction because we're not in the anatomical position. So I try to keep it by saying radial deviation. It makes more sense. I'm on the radial side. So that's another little trick. If you can say that and keep that in your head, it's as good as abduction, radial deviation. It kind of helps you. It might save you a mistake or two. So, extensor Pollicis brevis, and the longest again, brevis comes down the MP joint, first phalanx, and the extensor Pollicis longus goes to the extension distal phalanx. So it goes out here. So it's going to be extending at the IP. So again, I mean, the muscle's the same pretty much except you get here in the MP and the IP. So again, it's telling you something. So extensor Pollicis brevis runs to the extension of the MP joint. That's what it does, and radial deviation. But it runs to the proximal flanks of the thumb, and the extensor Pollicis longus goes to the distal. I mean, you can start making sense of some of these. So when you start memorizing, oh, the longest goes to the distal. You know, it starts making more sense. And that's what I would try to key on some of this stuff. Now the flexor, medial epicondyle. Guess most of your flexors are medial. Medial epicondyle of humerus to the base of the second and third metacarpals. So we're going to come across here the base of the second and third. And it does flexion and radial, flexion and radial deviation. So push into my hand and then push into my hand. That's all you have to do. Palmaris longus, medial epicondyle to the Palmar Aponeurosis. That's the aponeurosis. I'll put that picture up. Just again, students always want to come, oh, it goes here. I don't care. You just tell me it comes to the Palmar Aponeurosis right here in the middle. I'm good with that. Because look at it, you can't pick that apart. So don't worry about it. Come here. It's in the Palmar Aponeurosis, right there in the palm. Where are we at? And it does wrist flexion. That's it. So I'm going to push into my hand. And next is Flexor Carpi Ulnaris. Medial epicondyle again, these are all coming down. And again, you see one running here, one runs over second and third. The other one runs right kind of in the middle of that retinaculum and the aponeurosis. And this one, which is Flexor Carpi Ulnaris, medial epicondyle, comes to the pisiform, the hamate, and the base of the fifth metacarpal. So it goes to the other side. Again, you've got flexors now. You've got three flexors going here, here, and here. So it kind of starts making a little bit of sense when you think about it. So what's it going to do? It's going to, it's going to do flexion, and it's going to do what?
Ulnar deviation.
Yes, all right. Yep. So push into my hand, and I'm holding it right here. Push into my hand. I just want to stabilize that, okay? But you start seeing some of the stuff that's going on with it, I think, a little bit. Flexor Carpi Ulnaris. Sit down, Flexor Digitorum superficialis. And again, if I get messed up, help me. Okay, flexor, medial. And it comes down to the side shafts of the four fingers. And I think I got a picture of that. Flexor Digitorum superficialis. See the little, looks like a snake goes on both sides of it. Again, you don't have to tell me that. That's all it is. You just tell me it comes down, and it comes down to the four fingers, the middle sides of shafts of the middle phalanges of the four fingers. So it just runs on both sides. Flexion of the four fingers at the pip. Okay, so where's the pip? Yep, so it's running out to here. It's going to go past that pip joint on each side. It's going to flex at the pip. Okay, I'm going to hold her down right here. Push in my hand, and it also does wrist assists in wrist flexion. Correct? Am I okay? Again, you do not have to tell me assist. If you do, that's fine too, but don't worry about memorizing it. Just tell me it does wrist flexion. Flexor digitorum profundus. Here we go with the flexors that are not on the medial. You've got extensors not on the lateral. You got some flexors not on the medial. Again, this is what you want to put in your head. Flexor digitorum profundus, proximal anterior ulna. So it's going to be proximal, right? Anterior, going to be proximal anterior ulna, right? Is that correct? Nah, that's not correct. So where's it at? Proximal anterior ulna. Yeah, right in here. Yeah. Okay. And it runs to the bases of the four distal phalanges. That's fundus. Runs up. Base of the four distal phalanges. Distal phalanges, so what's it going to work? The other one work the pip, this is going to work the dip. See, they just get farther and farther, or they start going medial, lateral, back and forth. So flex, okay, just try to do all four. You don't have to be super picky when it comes to these muscles. Again, just tell me what it is. We could spend all day in there describing it, forks on both sides. Flexor Radialis Longus. Again, there, what we got? Pollicis.
Thumb.
Yeah, the thumb. So middle of anterior radius. This we're proximal ulna. This is middle anterior radius. We're on the other side. You see these are just kind of, you kind of see the pattern now that they're going back and forth. We're just hitting them all a little bit. Middle anterior radius goes to the distal flanks of the thumb. All right? And what's it do? Flexion of the thumb at the, it goes to the distal, IP, yeah. So right here. So it's going to run up, come around, run to the distal flanks. So it goes to the distal flanks, you know it's going to work that farthest joint, which is the IP. So again, I'm just going to hold it right here, push into my hand. There you go, my finger. Okay. Lumbricals, last one. The old lumbricals. Weird muscle. Flexor digitorum profundus tendons, which our book's got a good picture of them, are these right here. And I'm sure you guys have read this. So what's it do? You remember what it does? Have you guys looked at this yet?
Is it like that?
Nope, it does this. It flexes at the MP, and then what else?
Extends.
It extends these. Wow, I didn't think a muscle could do that. Flexor digitorum profundus tendons, which is just these middle tendons right here, which is inside, okay? And to the extensor expansion. So it just goes out into the extensor expansion, which goes around the flanges. Flexion of the fingers at the MP, that. I'm going to hold her here, push into my hand, and extension of the fingers at the pip and the dip. So pip, dip. So right here then, it's doing this. So it flexes at the MP, and these other two joints, the pip and the dip, it extends. So bend them and then push into my hand. How does it do that? I finally found a decent picture, I think, and you can look at it. See how it comes up here, and then it comes around to the top. So if you look at her hand, it's actually coming inside here to flex that MP joint, and then it's going out distally to extend the pip and the dip. And I'll leave this here for you to look at. That starts to make sense. I mean, you can't look at this way. If you look on the side, then you can see how that muscle is actually doing that. So it's going to flex and it's going to straighten it up. That's the lumbricals. Any questions? I know it's